Live from the 22 News Broadcast Center, your local election headquarters. This is a debate on ballot question 1. And now, here's Tamara Sakarczyk.
Good afternoon and welcome to a special Your Local Election Headquarters presentation here on 22 News. I'm Tamara Sakarczyk. Today, 22 News is hosting a debate on one of the most talked about issues on the November ballot. Of course, we're talking about question 1. If passed, question 1 would set mandatory nurse-to-patient ratios in hospitals and some other healthcare facilities. Joining us for today's debate are Emma Dragon. She's a registered nurse and is in favor of passing ballot question 1. And we also have Molly Gray. She's a chief nursing officer and is opposed to passing ballot question 1. We begin with opening statements. Each side will have 1 minute for their opening statement. By virtue of a coin toss, Molly Gray will go first.
I have been a registered nurse for 34 years, and I'm here to urge Massachusetts voters to vote no for question 1 because I cannot ethically support an initiative that I know is not based on evidence or best practice, and I know will cause harm. This law sets a maximum legal limit for a patient assignment. When that limit's reached, it won't matter what our nurse and physician teams care to do, what they want to do. We will not be able to care for more patients without breaking the law. And that will be leaving people in waiting rooms and ambulances and forcing the cancellation of elective procedures. The downstream effect is limited access to care, closing of services, and dissatisfaction with the deployment of specialized nurses to other assignments and other shifts. Western Massachusetts will feel the strongest impact, especially people of color and immigrants and low-income families who rely on our services. Massachusetts hospitals are the best in the world, but that could change. Question 1 is based on unproven ideas and backward thinking, and we must vote no.
Okay, and Emma.
If safe staffing limits weren't an issue, we wouldn't be here today. Nurses have been advocating for safe staffing ratios and numbers with hospitals for over 20 years. We've been trying to collaborate with them on this, and they just don't want to be accountable. Every day, nurses are liable for every single patient that we have to have under our assignments and take care of. Patients need us. The studies have shown, and the historical implementation in California has demonstrated that safe staffing limits and numbers have decreased readmission rates, which are very high in Massachusetts, and improved outcomes for all of the patients that have been able to be served. Thank you for supporting Yes on 1.
All right, well, thank you so much for joining us to both of you. We'll now move on to the question and answer portion of our debate. I'll ask a question and each side will have 1 minute to respond. We did determine the order of the questions by coin toss, and Molly Gray, you are lucky number 1. So we're going to start with talking about nurse staffing ratios. Here in Massachusetts, it's been discussed for many years, and it did not pass through the legislature. So is there a reason why we keep seeing this come back year after year?
Yes, absolutely. It is true that the M&A has been approaching the legislature for help with this particular law for 20 years, and it's not based on any evidence. And so it's for a very good reason that the legislature has backed off from that. When we look, for example, we do hear a lot of comparisons with the California law. What's being proposed here in Massachusetts has very little similarity with what happened in California. In California, that is a regulation that can be changed administratively. Here, what's being proposed in Massachusetts is an actual law that no matter how healthcare changes going forward, no matter what else comes towards us, this cannot be changed. And I think that it's very important for us to know that that's not the best way to take care of patients.
Okay, and Emma, the same question. This has been discussed in the legislature before. It's never passed. Why does this keep coming back?
Simply put, safe staffing limits keep coming back because it's an issue. It's a present issue. Our patients are sicker today. They need more and more of our direct care. While many people may only see a physician for short periods of time in their hospital care, nurses are the ones that are at the bedside. They're the ones that are advocating for you, looking at the research, making sure that you and your family are supported, asking your questions, and doing all that valuable education. The research has proven. We've shown over 70 peer-reviewed studies and research that support safe staffing limits, and that it can be really integral in improving patient outcomes. If this wasn't a problem, it wouldn't keep coming back. Nurses, even though the MNA has been the strong voice in this isn't just about the union. It's about nurses wanting to advocate for all of our patients.
I think one of the most confusing parts about this ballot question is the Massachusetts Nurses Association is backing question 1, but the American Nurses Association is against it. So why do these different nursing groups have different opinions?
Sure. So the majority of nursing organizations like the American Nurses Association and even the Emergency Nurses Association are made up majority-wise of executives and administrators that are not working at the bedside. These are nurses who aren't connected to how rapidly changing the dynamic needs are for our patients, and how really, even in the last 5 to 10 years, it has really shifted in terms of the care that we need to give.
Molly, we have one nurses union backing it, another against it. What's your opinion on this?
So first, I just want to follow up and say that Emma and I can definitely agree that adequate staffing is like food and water for us. So we do need to be sure to be able to address that. And over time, we have seen really thoughtful investments in staffing. So for example, most hospitals now have a rapid response team because we saw that nurses need the consultation of other expert nurses to help them sort through situations before there's a code blue, for example. In terms of why nurses are divided, and nurses are pretty evenly divided on this topic, as we can see in recent polls, about evenly divided, is that where those of us who are about vote no are really concerned that we're going to be capping access to care, and that it is appropriate to have safe staffing, and that this is not the right solution. This is not a solution that really benefits patients.
Molly, you touched on this a little earlier. California is the only state that has mandated nurse-to-patient ratios. How is it working there, and is this something that we would like to emulate here in Massachusetts?
So first of all, the two proposals are not similar in terms of what they call for actual restrictions on nurse-patient assignments. In California, this was not passed by a vote. It was not a ballot initiative. It is able to be monitored over time and changed over time. It's not a law that will be imposed from this day forward. There are 3 very good pre and post studies in California that demonstrate that there aren't better patient outcomes. There seems to be a suggestion that nurse satisfaction was improved. Then when you look at sort of the national detail, nurse satisfaction improved everywhere at that same time. So I don't think we can really attribute that to the California law. I really want to bring us back, though, to this idea that whether it's happened in California or whether it's happened in Massachusetts, this just is not the right solution. This is not the way to provide better, safer patient care.
Emma, same question. California is the only state with this. How's it working there, and is this something that we want for us in Massachusetts?
Sure. I mean, I'd really like to get and kind of refute what Molly said about nurses, that they're polling not supporting this ballot. I think there's a lot of intimidation that's going on in facilities right now where people don't feel like they can safely advocate for the way that they really ethically and morally support. California has shown that there has been wildly decreased readmissions. Yes, improved morale in nurses, a surge of nurses wanting to work in a state where there is safe limits to their nursing practice so that they can adequately take care of those patients that they're legally responsible for every single day, no matter how wildly unpredictable the staffing patterns are. This is about instituting consistent, safe healthcare delivery for all of our patients, no matter where they live or what kind of insurance they have. California has proven that this can really change and help support our public.
Emma, one of the biggest points of contention in the debate over question 1 is the money factor here. So we have two major estimates that are very different from each other. The Massachusetts Health Policy Commission found it would cost $676 to $949 million. The Massachusetts Nurses Association estimates the cost would be $35 to $47 million. Which number is correct, and why is there such a large disparity?
I believe the nurses factors are correct. I certainly can understand that the hospital is going to support the Health Policy Commission's data as being correct. The Health Policy Commission evaluated a 4 to 6% increase in nurses' wages, which is just cannot possibly happen. The majority of hospitals in Massachusetts have bargaining contracts where raises are limited, and that can't possibly happen. It also estimates with their overall thing that their nurses would be making $300,000 a year. That's their projected budget under this, and that just doesn't make sense. Nurses do not make nearly that amount of money.
Molly, same question. This huge price disparity here. We're talking tens of millions of dollars of differences here. What's your take on this?
Yeah. So that $900 million a year cost has now been corroborated a number of times. That same figure was first calculated by the Mass Hospital Association. Then they went out to an external consultant, found the same figure, and then Health Policy Commission. The Health Policy Commission came together in 2012, and their job one is to contain healthcare costs in Massachusetts. And it's interesting that M&A selected them to implement and to enforce their own law, and now is criticizing the Health Policy Commission's analysis. Also, Judy Schindel-Rothschild, who did do the work for the M&A, she's not a disinterested bystander. She's worked for the M&A, but she has walked back that $47 million and has increased it and said she thinks it'll probably be more in the order of $200 million.
All right, thank you for that, both of you. We are at the halfway point in today's debate. We're going to take a 2-minute break, and then we'll be right back here with more questions for both sides on ballot question 1. You're watching a special Your Local Election Headquarters presentation on 22 News. Good afternoon and welcome back to our special Your Local Election Headquarters presentation. Today we're hosting a debate between both sides of ballot question 1, which would set nurse-to-patient ratios at hospitals and other healthcare facilities. Let's get back to the question and answer portion of this debate. I'll ask a question and each person will be given a minute to answer. Molly Gray will answer this next question first. So Molly, would nurse staffing ratios have an effect on wait times in the emergency rooms if this question were to pass?
Oh, absolutely. Now, first of all, let's say there is an argument, I know, that if there's richer staffing, then things will move more quickly through the EDs. And there's a piece of that that makes good sense. Where I have a very serious concern is that patients don't really arrive to us in an orderly fashion. They come, when they need care. And we will not necessarily always be able to stick to the actual ratios, which are quite complicated. If you read the ballot question closely in the ED, there are 5 different patient assignment restrictions. And so first of all, we would have to figure out how many patients are assigned to each nurse. If a nurse has 5 sprained ankle patients, for example, and a mom brings in a wheezing baby, she would have to tell the mom to wait, and that doesn't make any good sense to me. So we know that we already have throughput issues. That suggests to me we need more services, not restricted services, and I'm very concerned about the restriction of care.
Emma, would nurse staffing ratios have an effect on emergency room wait times?
Absolutely, they're going to get better. Bay State has one of the longest wait times in the entire state. Cooley-Dickinson has actually the longest, unfortunately. California wait times are much lower than they are in Massachusetts. Massachusetts ranks 48th out of the 50 states for ER wait times and access when patients need that. The preposterous statement that nurses are ever going to have to choose between taking care of a patient or unethically breaking the law is so wrong that you're even putting that message into the public is I can't even. I'm offended by it. We all take a moral oath as nurses that we will always take care of our patients and always put their needs and advocate for them. This law isn't ever going to make nurses break the law. This law is about hospital accountability and hospitals finally having to take responsibility for providing safe and adequate care for their patients.
Emma, if question 1 passes, this is another major topic that I've heard a lot of voters talking about. What do you think would happen to health care costs for the consumer here in Massachusetts?
That's interesting, because actually Massachusetts right now is one of the highest above national average expenditures per person for health care needs. California's cost drastically dropped after instituting this bill. Their expenditures. Also, Massachusetts has one of the highest readmission rates in the entire United States, and that can be found under CHIA data and also Center for Medicare Studies. We have to make it better. Massachusetts spends over $900 million on preventable readmissions and fines that could be supported by instituting safe staffing.
Molly, same question. If question 1 passes, what do you think would happen to healthcare costs for the consumers in Massachusetts?
Yeah, I feel a real responsibility to go back to Emma's sort of indignation about not being able to take care of patients. And I think that emotion is real, but that's how the actual law is written. I didn't write it, the M&A wrote it. It calls for this restricted staffing at all times without exception, one only exception being during a public health emergency. The last public health emergency in Massachusetts was in 2014. It's when Governor Deval Patrick called in a public health emergency regarding the opioid epidemic. So we are imposing a law with which nurses will not be able to comply. And you're speaking exactly to something that concerns me very much, which is the moral distress that nurses will suffer trying to choose between those false choices.
Molly, we do have to move along to the next question. Nurse-to-patient ratios has been an issue in contract negotiations between hospitals and nurses unions. This has been happening across Massachusetts. Do you think the labor disputes between nurses and hospitals would decrease if question 1 passed?
I don't know. For one thing, I haven't personally practiced in an environment where the union was in place, so I don't have close experience with that. I do think that we are setting ourselves to limit access to care, and in particular in our vulnerable community hospitals. I work in a community hospital now, Bay State Wing Hospital, which already operates in the red. We are already subsidized by the healthcare system, and that is a very fragile source of healthcare that I am thoroughly concerned would be jeopardized with the passage of this law.
Okay, Emma, do you think that labor disputes would decrease if we saw question 1 pass?
I think labor disputes are advocating for patient needs. I think nurses and other healthcare workers that also have unions will always advocate for those supports that corporations and hospitals are choosing to not support at the bedside. Hospitals make choices every day where they want to institute their money, and they're just choosing to close down facilities every day, limit programs regardless of this bill. The idea, and I'm sorry, Molly, that nurses are going to ever have to break the law, that's not how this law is written. It is a safe staffing limit that we're all agreeing on, and there will also be that non-rigid acuity tool empowering nurses to use scientific and consistent data to provide safe care for their patients throughout all forums.
Emma, if question 1 is passed, would this law go into effect on January 1st as it's written in the ballot question? And if so, does that mean hospitals would have to hire these additional nurses by the first of the year?
I think that's absolutely one of the scare tactics that the no side has been really supporting in this ballot. The law says nothing, absolutely nothing about needing to be fully staffed within 37 days. If anybody has had some history classes or anything like that knows a little bit about bills and laws, it says enacted. It says that this law will be enacted on January 1st. All that will be asked for hospitals is a plan to what their staffing needs will be and how they're going to be upstaffing. It is asking for hospitals what their acuity tools will be. There is nothing saying that hospitals are going to have to hire these projected nurses to meet the safe staffing limits that are in this law.
Okay, and Molly, your side of this, if question 1 passes, would the law go into effect on January 1st? And if so, does that mean hospitals would have to have these additional nurses hired by the 1st of the year?
So I am not a lawyer. However, I have seen the specific language of the law, which says that it will be enacted on January 1st, which means that it goes into full effect on January 1st. I do want to circle back to Emma's concern that a nurse would never be breaking a law. You do need to take a look at the specific language of this proposal, and it does say that this staffing needs to be in place at all times, and that a $25,000 fine would be imposed for every incident every day. That is calculated to be something on the order of about $1.8 million per day in Massachusetts, in addition to the $900 million, because of the gap we have between where we are now and what this would be called for.
All right, we have time for one more question. Molly, I'll start with you. How do you think the quality of care would change at your local hospital if question 1 were to pass?
Yeah. So at my local hospital, Bay State Wing Hospital, as I said, we've been operating in the red. We've been doing a really excellent job of turning that around so that we can get to break even. And we've done that not by cutting clinicians or caretakers at all. We've done that by growing volumes. We just invested $18 million in a brand new emergency facility. We definitely needed that because we were operating actually the busiest emergency room per square foot in a very inappropriate physical plant. And I really want to protect that investment. I want that care to continue in that region. One of our major determinants of health in that region is lack of transportation. Folks are not going to be able to easily drive away from the area to get care elsewhere.
Emma, how do you think the quality of care would change at your local hospital if question 1 were to pass?
I think it's going to drastically improve. I think the consistent healthcare delivery by providing safe staffing to all patients, no matter where they live, no matter what your insurance is, no matter what hospital you're accessing, is going to be wonderful. I think people deserve that as a community and as individuals and as loved ones. I think that the statement that is egregious on Molly's case, saying that there's going to be a $25,000 fine every time for every patient every day, that's just preposterous. That's not how this law is written. I urge people to read the law for themselves. It says after a 5-step review process, finally, ultimately leading up to the Attorney General and the Supreme Court, that a maximum of a $25,000 fine would be in place. Also, Bay State is it is the second most profitable hospital in this entire state as an organization. And the fact that they would not support their other facilities, such as Wing, which you have identified as a vulnerable hospital, is really a challenging force to me.
All right, I want to thank you guys so much. It's time for closing statements. Both sides will have 1 minute to make their closing statement by virtue of a coin toss. Emma Dragon, you will go first.
If safe staffing wasn't an issue, we wouldn't be here today. This has been something that nurses, not just in Massachusetts, this isn't only an isolated issue in our state. This is being pursued in 7 other states across the United States and also by nurses across the world. This is a widespread need. There needs to be a change. The government is also supporting safe staffing for pilots and truck drivers and also firefighters, that the government is already supporting safe healthcare delivery and also access to other needs within our culture. We can do this bill. It has been scientifically proven through over 70 peer-reviewed studies that it improves access, decreases readmissions, improves patient outcomes and education. We do have the money. And we need to make this possible for all of our public and also for the nursing profession in the future.
Molly, in your closing statement.
No existing scientific study has determined a correct nurse-patient ratio. Question 1 is based on an irresponsible oversimplification that ignores the many variations in patient care, including differences in nurses' education and experience, ever-changing patient conditions, the composition of the whole patient team, As a nurse leader, I feel a personal responsibility to let people know about the devastating negative outcomes and tough decisions that lie ahead should this become state statute, and that we will not be able to turn back after the damage is done. Our most vulnerable patients served by our community hospitals in Western Mass will bear the brunt. And it is outrageous that physicians and nurses would not be permitted to take care of patients who need their care without breaking the law once they've reached their legal limit. Please join me and thousands of nurses, every single professional nursing organization, and hundreds of trusted healthcare organizations by voting no on question 1.
All right, that is all the time we have for today's debate. If you missed any of this, the entire debate will be posted for you on our website at wwlp.com. I would like to thank Emma Dragon and Molly Gray for participating in today's debate. Be sure to join us Friday afternoon at 12:30. 22 News anchor Rich Teddemer will be moderating a debate between candidates running for Hampden County Register of Deeds. Election Day is Tuesday, November 6th, but early voting will continue through Friday. Be sure to make your voice heard. I'm Tamara Sakarzik. Have a great afternoon.